Recognized by her colleagues and the national media as a leading voice for working families, Linda Sanchez has represented California's 39th Congressional District since 2003. She currently serves as the ranking member on the Ethics Committee and is also on the Judiciary and Veterans Affairs Committees. In the House of Representatives, Sanchez continues to fight to give working families the dignity, power, and attention they deserve in Congress. In addition to reducing crime, making public schools safe for our children, and providing quality education and affordable health care for working families, Sanchez is committed to developing a pro-worker agenda in Congress. In September 2003, she co-founded and is a current co-chair of the Congressional Labor and Working Families Caucus. Mr. Mishu, who was here earlier, is another co-chair, as is Stephen Lynch of Massachusetts. Congresswoman Sanchez believes that all work has dignity and introduced the Direct Care Workforce Empowerment Act in the 111th Congress to provide equity to those we trust enough to let into our homes and care for our loved ones. She will be reintroducing this bill with a slightly updated name very soon.
Thank you, and my apologies. It's been a kind of a crazy busy morning, and I hope that I'm not sort of bringing things to a screeching halt to speak and then resuming. But I want to thank Celeste, first of all. I don't know if y'all are aware that Celeste and I go way back. She was most recently a member of my legislative team, my legislative director, and her work on this legislation has been invaluable. So it's sort of bittersweet to be here with Celeste. She's sprouted wings and moved on to bigger and better things. But before I talk about the Direct Care Job Quality Improvement Act, which is the new title for this fifth-up bill, I also want to thank just a couple more people, the Direct Care Alliance, certainly SEIU, AFSCME, NELP, and PHI. I want to thank these groups for their help and their significant contributions in helping us craft this bill. In many ways, I really wish that I wasn't here having to talk about this bill, because as an American, I am ashamed, and I think all Americans should be ashamed, for the little that we really do provide for home health care workers. It's sort of shocking to me to think of that we rely on this workforce to help care for the ones that we love the most, our parents, our grandparents, but we don't do simple things like guaranteeing them minimum wage. And because I think it's a matter of respect and basic fairness and dignity for direct care workers, that I am reintroducing the legislation, which again has this fifth-up title of the Direct Care Job Quality Improvement Act. And my hope is that we will improve the direction of direct care services across the nation. And it's funny because driving into work today, I heard on the radio, they were talking about the fastest growing demographic in this area, which is seniors, and they're calling it the gray wave, and I've actually heard others talk about it as more like a tsunami. So that is the future of this country, and if you think about the work that direct care workers provide to seniors, the demand for that is only going to grow as that population grows. Right now, direct care workers provide essential care and daily living services to more than 13 million elderly and disabled Americans. And so the importance of their job can't be overstated. Yet about 46% of direct care workers rely on some form of public benefits. They're not, as I said, entitled to minimum wage. They're not entitled to overtime pay. And many direct care workers don't get health or retirement benefits, which I think is kind of the ultimate irony. Here they are caring for others and they don't even have health care themselves. Those factors, plus the often poor working conditions that they face, force direct care workers to look for other work. Because let's face it, if you're working in very long hours, very little pay, and no financial security or benefits to it, other things may look more attractive. And the fact of the matter is, again, because we're seeing that gray tsunami coming, if we have this high turnover rate in direct care workers, it's going to impact not only the ability to even have folks performing that kind of work, but the quality will potentially go down if people are leaving that field to look for something a little more lucrative. The way that we treat home health care workers, who are the linchpins of our nation's long-term care system, right now is just not sustainable. It's unconscionable. So we are long overdue in thinking about this workforce at the federal level and giving them the dignity and respect and security that they deserve. There are no national training standards for training these workers, no career ladders to encourage longevity and professional growth in this field, and no federal policies that ensure quality care. We offer them so little support that it's shocking, yet again, they are often caring for the ones that we love the most. So that's sort of the reason that has propelled me to introduce this legislation. And in the legislation, we would ensure that home health care workers receive the federal minimum wage and overtime protections of the Fair Labor Standards Act. We would make sure that we improve federal and state data collection and oversight with respect to the direct care workforce. And we would also establish grant programs to help states improve direct care worker data collection, recruitment, retention, and training. All of these three things, I think, very necessary to attract workers and keep them in that field. This is something that I find really sad. Every year, home care workers make Forbes magazine's list of the 25 worst paying jobs in America. And even sadder than that statistic is the fact that parking lot attendants do better. So we have to really do a little soul searching as a society and ask ourselves, really, is the safety of our automobiles more important than the safety and the care of our loved ones? As a society, if we're not able to demonstrate how important this work is with fairness in wages, what does that say about our priorities in this society? We are facing, as I said, not only this gray tsunami coming up, but we as Americans have a very diverse population. So we're facing some additional challenges with respect to those who will need home health care service or direct care service too. So there are issues of quality that are going to be front and center as well. How are we ever going to hope to recruit enough high quality, linguistically and culturally competent direct care workers, because there is a component to understanding the client base and what their needs are. And again, how are we going to ever do that if it's a one of the least paid and most unattractive fields to go work in? And why do I care so much about this? And why is this such a sticking point with me? My father has Alzheimer's, and if it weren't for this workforce taking care of him, it would be incredibly difficult for my family to manage it. And I have to tell you, I'm luckier than most. I come from a family of 7, and we all have had, up to a certain point in my father's care, we all split the responsibilities for his care and tried to delay needing professional care as long as we could. But there came a point at which it just wasn't safe for us to provide that care, and we really rely on others to do that. I'm sure everybody in this room probably knows of somebody who has required the assistance of a direct care worker. They do these incredible things, and they help people stay in their homes as long as possible. They help them retain their dignity and their independence, and they really are a tremendous asset to this country. We need to start treating them like they are. So while I wish I didn't have to introduce this piece of legislation, it's very clear to me that it's long overdue. And I thank you for your participation in the briefing today, and I welcome your help in the fight to try to get this legislation passed. Because if we do value the elderly and the disabled, we should make sure that they have the care that they need, and we're only going to do that if we start treating providers of this care with the dignity and respect that they deserve. So thank you again for being here, and again, Celeste, I'm sorry for interrupting whatever discussion was going on, but I'm really touched that y'all are here today and that you're ready to join me in that fight. So thanks.